Hey guys, in this short video, let us learn about the hypothalamic nuclei and their important functions. So here is a table which is compiling all the important nuclei that you need to know for the exam. And the second table is more or less the same. Firstly, let us learn about the first table which has all the mnemonics written over there. This is the question that we need to solve at the end of the video. Just go through the question, think about an option as an answer in your mind, and later we'll come back to this question and solve it together. So as always, I'll bring a question also, right? So this is the question of the day. This table was actually posted by a aspirant in the Telegram channel, in our Telegram channel. So I just thought I'll make a video like now and post it. So this is going to be a short video which has all the mnemonics. Firstly, the hypothalamic nuclei under discussion are supraoptic, paraventricular, preoptic and anterior, posterior and lateral, anterior, posterior, lateral, medial and suprachiasmatic nucleus. So firstly, let us come from the first part of the table itself, which is supraoptic and paraventricular nucleus. So this is the most confusing part. The posterior pituitary hormones, that is ADH and oxytocin, are produced, that is synthesized in the hypothalamus, right? So they are synthesized in the hypothalamus and then they enter into the posterior pituitary, as all of us know. So the two important hormones under discussion are vasopressin, which is otherwise called as antidiuretic hormone, that is ADH, and the second hormone here is oxytocin. So the main confuser here is which hormone comes from which part of the hypothalamic nucleus. So here we have this vasopressin name, in which you have S, O and P in the middle. That means supra OP is optic, right? So the supraoptic nucleus, you have to give it to the vasopressin, that is ADH. So the remaining one, the oxytocin, is from the paraventricular nucleus. So the first confusion is sorted. Vasopressin, the name itself has SOP in it. So supraoptic is ADH, whereas paraventricular is oxytocin. Now comes the next confusing part, which is for parasympathetic and which controls the sympathetic system. So for that, the mnemonic is PAPS. So here it goes like PA, that is parasympathetic system, is from the anterior nuclei control or the preoptic nuclei, whereas the sympathetic, right? So S here is sympathetic, which is controlled by posterior and lateral group. I hope the confusion is sorted now. So PAPS mnemonic itself has two P's, so you don't need to confuse. The first P and A goes together. So parasympathetic is for anterior or preoptic nuclei, which again has a P, and the posterior and lateral nuclei are for the sympathetic system. So now sympathetic, parasympathetic with the mnemonic is done, right? Now comes the next confuser, which is for heat and which is for cold. So for heat, remember it as heat, which is anterior nuclei, whereas for cold, the second letter is O, and in posterior also the second letter is O. So for posterior nuclei, it is cold. So it regulates the temperature. Both of the nuclei regulates the temperature. So one shows the response to heat, that is heat, and the second one shows the response to cold, that is post, right? And then comes the next two confusers, which is for increased appetite and which is for decreased appetite. So here I have got a diagram of a man. So let us suppose this is the abdomen of a man. So you grow laterally. Let me change the color. Yeah, you grow laterally when you eat more, right? So initiate eating and increased food intake and increased water intake, that is the hunger center and thirst center, increased signals via the lateral nuclei. That means you grow laterally, that means you are becoming fat because of increased eating and increased drinking. Whereas when you become thin, like you grow towards the medial ends, that means you are inhibiting eating and reducing the food intake, that is the satiety center function. So laterally it is for the hunger center, whereas medially it is all about the satiety center. So this completes this confuser part. And one more point that you need to remember here is about the arcuate nucleus. Arcuate nucleus is the one which regulates both, like increased appetite and decreased appetite accordingly. So it has functions of both lateral and medial nuclei. And last comes the suprachiasmatic nucleus. As all of us know, it is for circadian rhythm. This is the most frequently tested nucleus in the exams. So suprachiasmatic is for circadian rhythm. I hope this table is easier now. So let us go through this once again. Let me change the color. So yeah, supraoptic, paraventricular, the confusion is clear now, right, with vasopressin. And then anterior and posterior nuclei for PAPs, which is parasympathetic and sympathetic. And then comes anterior and posterior nuclei, which is heat and post is cold. Then lateral and medial nucleus, with the help of this image, we can remember if you grow laterally, that is hunger center. If you grow medially, that means you shrink inside, that is satiety center. And suprachiasmatic nucleus is for circadian rhythm. So the second table is also more or less same, like medially, that is satiety center. Arcuate, as already told, both either increase or decrease the appetite. And supraoptic, SOP is SOP, vasopressin. And here comes the paraventricular nucleus. The main thing is oxytocin release, and the extra functions are also there. If you want to remember, you can remember, or it's not that important. The main important thing is oxytocin is released from paraventricular nucleus. And here comes the temperature regulation. Heat is anterior, and PO is CO, posterior is cold, right? So this is related to sweating. And coming to the anterior hypothalamus, this is also an important question. So which of the following nuclei of the hypothalamus functions as osmoreceptor? So that is anterior hypothalamus, and lateral hypothalamus is for hunger and thirst. So yeah, shall we solve the question now? So here is the question, which was displayed in the beginning of the video. So a man sustained head injury following RTA, and that is road traffic accident, and he complains of increased frequency of micturition and increased thirst. Injury to which of the nucleus causes the given condition, right? So increased frequency of micturition. So here itself we can tell that there is a decrease in the ADH, right? So what does an antidiuretic hormone does? It prevents the diuresis. That means it prevents over urination. So antidiuretic hormone, when it is less, there will be increased frequency of micturition and increased thirst. Once look at here. 1 second. So yeah, supraoptic nucleus is vasopressin, right? So here, since the deficit is because of decreased ADH, that means it is the damage to supraoptic nucleus. So your answer will be B here, that is supraoptic nucleus damage causes increased frequency of micturition and increased thirst. So here's how the questions are asked. They are clinically correlated, and they expect you to know the function of the basic important nuclei of the hypothalamus. I hope this video helps you memorize these nuclei in an easier manner. I'll provide the PDF in the Telegram channel, so you can go check there. So like the annotated ones only I'll provide, so that all the mnemonics will be at one place for you guys. Thank you, and please show your support by liking, sharing and subscribing to the channel. Bye.